The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Are you well informed? My name's Mark Cardoza. I'm your host today. We're in Brockton at the intersection of Torrey and Pearl Streets at a building that you probably go past on a daily basis or whenever, and you wonder what goes on there. Well, it's Harbor Health's PACE program. PACE stands for Program of All-Inclusive Care for the Elderly. Now, I had to focus on saying that. Try saying that 3 times fast. It doesn't happen. I have experience with PACE. Although I wasn't a participant, I cared for someone that was a participant. And when I think of PACE, there's 2 words that come to my mind: care and compassion. And with that said, I want to bring in the community relations specialist for Harbor Health Plan, Kerry Conlon. Kerry, come on, join me.
Hi, good afternoon, Mark. Welcome.
Thank you. Thanks for inviting us to do this tour.
Oh, so happy and delighted to be able to show you around today.
It's great. So how long have you been with PACE?
Mark, I've been with the PACE program for the last 18 years.
That's awesome.
Yep, so I've seen the model grow. When I first started, I was in Boston, and the program model has grown, and we opened here in 2017.
Wow, that's great. So let's go through the when, the where, and the why of PACE. So when did PACE start? Where did it start? And why do we have PACE?
Sure. So PACE has an interesting history. It's a model of care, a national model of health care that started out in California in the late 70s. And it was designed as a nursing home alternative. And the program has grown across the country. It started here in Massachusetts about 30 years ago, and Harbor Health is one of 8 PACE programs here in Massachusetts, and we've experienced our own growth. Like I mentioned, we started in Boston, and now we're in probably over 40 communities, so offering these services to older adults who wish to stay safe and supported in their community setting of choice.
So I'm familiar with the Mattapan. It's on the Milton line.
Yes.
And I'm familiar with that one, and this is the second facility, second center.
Correct.
Under the Harbor Health Elder Plan.
Right. So our location in Mattapan opened it started in Boston and Dorchester, and then moved over to the Mattapan Center, which you've seen, which is beautiful. And Harbor Health bought this building back in 2016. It underwent a significant renovation. It was formerly known as the Temple Beth Immuna. Yep. So many people who are from this area for over 40 years can remember it as the synagogue. And it was very thoughtfully renovated, and I look forward to showing you inside.
Yeah, it's going to be a lot of fun. But before we go in, I see a bus pulling up.
Yes, so this is our transportation. These are our vans that are bringing people to and from the PACE Center. They're coming here for medical appointments. They're coming here for participation in our day program. And they're out on the roads bringing people to and from medical appointments.
Awesome.
So you'll see them all around the community.
Excellent. So what's the affiliation between Harbor Health and PACE?
So Harbor Health is our parent organization. Harbor Health is a nonprofit public health organization that operates 5 different community health centers, from Boston down through Plymouth, down even into Cape Cod. And they also operate our 2 PACE centers, the one that we'll be seeing here today in Brockton, and also our location in Boston, specifically in Mattapan.
As you know, Well Informed by ThinkSmarts is a program that is offered through the Retirement Education Resource Center of North America. So we're a national group. So if I'm outside of the Harbor Health program and I've watched this documentary, where do I find the local PACE program that in my area?
Certainly. Within Massachusetts, there's a Massachusetts PACE website, which allows you to enter your zip code, and that will let you know which PACE program is in your community. Additionally, there's a national PACE website, and that will allow you to enter your zip code to see if your community or state participates in PACE. Currently, there's about 33 states that participate in the PACE program.
That's awesome.
Across the country, and again, that's growing.
That's awesome. And it's based on geography and population density in that area.
Correct. Yep.
Excellent.
So there's clinical criteria, there's demographic criteria, and financial criteria to enroll.
Excellent. So do you want to add anything else before we go in?
No, I look forward to showing you around. I think what you'll see inside is a very clean, vibrant setting that's very welcoming to our participants. It's a place that their loved ones know that they're being looked after in a safe setting, meeting their medical needs and social needs, etc. So lots going on.
Care and compassion.
Certainly.
So let's check it out.
All right, follow me.
Thanks. One thing I want to point out is the safety and security of the center. In order to get in, Kerry has to swipe in, and then we're met by a person at the reception area. So let's do it.
Okay.
Hi, Michelle.
Hello.
Hi, I'm Mark Cardoza, and we're doing a documentary on PACE.
Yes.
And just a couple questions. How long have you worked with PACE?
I've been at PACE in the Brockton office here as a receptionist for about 1.5 years.
Awesome. So when you decided you wanted to go look for a job, you researched the facility and you said, okay, I want an interview. And when you interviewed, were you surprised to see what goes on here?
I was completely shocked, totally surprised, didn't know anything about it.
Why?
It just looked like another office building to me. I just drove by it 1,000,000 times. I had no idea. I tell my friends about this place, the services, the goals of keeping people out of nursing homes, which I didn't even know there was a place that would do that. And it offers just a great variety of services that everybody should know about.
Great.
Yep.
Well, thank you very much.
All right.
Appreciate your time.
All right.
Kerry, can anyone come here and be cared for by PACE?
So, Mark, in order to participate in this program, one has to qualify and become a participant. So there is clinical and financial criteria that needs to be met in order to benefit from this model.
So the clinical, I'm assuming, is minus ADLs.
Correct.
Or cognitive impairment.
Right.
Okay.
So what we do is we send a nurse out to the home of the interested applicant to conduct a clinical assessment. And it's during that time that the nurse can identify what some of the skilled needs are. And like you had mentioned, maybe looking at ADL needs, diagnosis, to make certain that they meet the state's level of care.
Okay. So let's do a deep dive into ADLs, which isn't hard. What are the ADLs?
Well, just to go back, activities of daily living is what ADLs stand for. And those can be things like bathing, dressing, taking medications, things that are necessary for one's daily living.
And there are 6 of them.
There are. And so we can assist by putting those care needs in place through our program.
So you mentioned that financially they have to qualify. So give us the financial, give us an overview of the financial criteria.
So the PACE program is a state and federally funded program. It's offered through the offices of Medicare and Medicaid, which is also known as Mass Health here in Massachusetts. So in order to participate in this program and not incur any expense, one needs to qualify for community Medicaid. If somebody does not meet that eligibility, they have the opportunity to private pay for the program. And then additionally, there is the opportunity to pay a copay to participate in this program if they are over the Medicaid income limit.
Okay.
So there's various facets to qualifying financially.
Great. So how does a person with long-term care insurance, how does that work?
So the long-term care insurance can pay their private pay portion, which is generally about $4,800 per month.
Okay, so let's dissect that $4,800 a month. And in the scheme of things, when you're caring for somebody at home, bringing in help, that's not a lot of money. And a lot of people might say that is a lot of money. And with some people it is.
Right.
So let's dissect that $4,800. So if I have a participant that's in Harbor Health PACE, do they have to pay for their private health insurance.
They don't.
Like a supplemental.
They don't.
So
no.
they have Medicare,
Mm-hmm.
and they don't have to pay for a supplemental.
Right. We become their provider of care, but also their insurance plan.
Do they have to have a medication, a Part D drug prescription
We become their
plan?
prescription plan. So everything is covered in full. There's no co-pays, there's no prescription costs. All their medical expenses are covered. Their participation here in the day program, home care, any equipment, medical equipment, their transportation. So it's very comprehensive.
If I want to get a real perspective of how much it's going to cost to put my elder into the PACE program, I have to take the $4,800. I have to subtract the cost that they're spending for health insurance, what they're spending for a Part D if they have a prescription plan.
Correct.
Sometimes it's included. And then I have to look at co-pays, what we're paying on a monthly basis.
Right.
And that gives me my real number
Yep.
of what it's costing.
All
Then if
those
I have a long-term care policy, that even gets thrown into the mix. So this program isn't just for people that are Medicaid qualified. It's also for people that can afford to pay for it on their own.
Correct. Right.
And I know that you do seminars with professionals every so often. You'll invite estate planning attorneys, CPAs in, and you want to educate them
Right.
about the program, because a lot of times it requires those professionals
Right.
to help the participant qualify.
Right. Many of those professionals are working with families who are really trying to maintain their loved ones' independence in the community. And having access to a program like PACE is huge. And we rely on their expertise to help them navigate this whole financial planning aspect, both professionally and from a legal perspective as well for estate planning.
So I want to address the viewers and let them know that they're not alone. They have resources that they can tap into and people they can call to help. So they would call here and ask for help, and they can coordinate. But also, they need to do their due diligence. So they need to dig in and do some homework and make sure somehow how they could pay for this program before they find that they say, I'm not going to get into this program because I can't qualify or it's too much work. There are people here that can help qualify them, and people that can help design a program for them. Does that make
Correct.
sense?
Yes.
Okay.
Yep.
So I know PACE, we toured this beautiful facility, the center,
Yeah.
and I know there's other things outside the center. So I know you do home health, because I see all these empty offices.
Right.
And I asked you, what's with all these empty offices? And you said to me, these are all working outside.
Right.
They're
Many of our
people-
providers are on the road on a regular basis, seeing their patients right in their home setting, which you don't hear of very often these days, right?
Right.
Yeah.
And then there's assisted living communities.
There are. Yeah.
So tell me, how does a person, so if I want my parent to be in PACE and I want them in an assisted living community, how does that work?
Sure. So again, our goal is to keep people supported and safe in their community setting of choice. And that can be at home, it can be with family. And for many people, it means maybe living in an assisted living community. And we contract with several different assisted living communities around the area. And the idea is that folks can live and have this beautiful style of living available to them, and then additionally have all the support of the PACE team while they're living in that setting. So we know that their needs are being met and provided in the assisted living for their personal care, for their social needs, for their meals, med management, and then our PACE team is quite present in those communities, following those PACE residents very closely.
And I want to point out to the viewer, this includes cognitive impairment.
Correct. Yes. So many of the communities that we contract with have dementia-specific units. These are smaller, more supportive.
Let's go to the worst scenario.
Right.
Well, I think the second worst scenario. The second worst scenario is having to go into a nursing home. And that's when PACE steps in as well. So PACE follows this person right through each stage.
Right.
So how's the nursing home aspect work?
So what, like you say, what is so nice is when somebody enrolls into this program, they come under the care of this team that we speak of and that you've met. But what happens is that through the course of one's disease progression, their needs change. And what's so nice is this model of care can grow with them. And again, we talk about being a nursing home alternative, but we know that for some people, it gets to a point in their disease progression where they're no longer safe in their community setting. And for some people, that may mean going on to a nursing home facility. And understanding with PACE, this is a voluntary type program. So if their needs do progress and change, they have the opportunity to disenroll if they so choose, or they can stay with this program right through the end of life. And what's nice is that they have a team that they've trusted, that they know, that can help kind of navigate that next step, which is very, very supportive for families as well as our participants.
We have all these assisted living opportunities at nursing home. So when a person comes to the end of life, hospices and palliative care are such a valuable tool for these people and their families.
Right.
How does that work?
Right. So our team will put into place a hospice program, and that's looked at based on what the individual wishes are for their end of life. And we have so many rich resources right here within the PACE team as far as for social supports for the families. We have a chaplain that really helps. We have pain management, and our providers certainly can put in that hospice approach to their care.
So do you find that you become part of the family?
And for many, they do refer to the PACE team as their PACE family. And for many people, as they get older, they may not have as many community supports, so they may not have as much family involved. So you can see how this team can get so involved and become really an extension of family in some ways.
Interesting.
Yeah.
Yesterday, I was with a client, and before we did this documentary, and the word PACE came out of the husband's name, and his mother was a participant in PACE.
Oh, okay.
And I stepped back and I said, well, what was your experience with PACE? He said, Mark, he goes, it was great. I wish I had learned about it sooner. She was in PACE for only a short period of time, but the quality of care we received, and I don't mean to put words in his mouth,
right,
but it was a very positive, response.
That's so nice. Yeah. And it's not uncommon now that we're meeting more and more people who are familiar with the model due to, all the education and community outreach that we're doing, but also we have about 600 participants now in our program. And so many people will say that they wish they had known about it sooner, or they can think of a family member or friend who would have benefited from this program. So that's why we're happy to get the word out.
Yeah, I learned of it through an attorney that asked me to get involved with his client's quality of care. And he directed us to PACE.
Nice.
Wonderful.
I'm glad you had a good experience. Yeah. And I have to say, across, the board, we have a very high satisfaction, both for participants and their caregivers.
She used to come here and she would have meals, and her husband was in his 80s. So it was very difficult for him to cook for her. And as you know, when people get older, they don't eat properly.
Right.
I call my mother and sometimes she's eating peanut butter and jelly for dinner. And, even though that might be okay occasionally, but
you
not
want
on a
her to
regular
have
basis.
a proper diet.
So proper diet's important for skin and everything else and life. And it's great to know when they come here that they're going to get a couple of good square meals a day.
Yeah, hot meal is served right here. And we do have a dietitian on staff who will work with people to create meal planning for their disease, what best, and works with their meds as well.
This is for the participants.
That's right.
And the only people that use this room are the participants.
So our participants work work alongside their physical therapists and occupational therapists. Each of our participants has the opportunity to create a goal plan and work alongside a therapist to meet those goals. In addition to skilled therapy, we're also offering maintenance therapy to keep people conditioned, strength, fall prevention. So there's a lot that our therapists do here. Right now it's quiet, as you can see, because many of our therapists are seeing our participants right in their home setting and working on things right within their home, within their community.
So one thing I want to stress to the viewers, this is only available to the participants. It's not open for public. The doctor can't write a prescription and send you here to have physical therapy, occupational therapy.
Right.
You have to be a part of the PACE program.
Mm-hmm. So the therapy that is offered from PACE is just another modality that is part of the interdisciplinary team. So as we know with PACE, it's very holistic. It's a very preventative model. And that the idea is that you have this team that's made up of several different disciplines and working to create the best care plan to keep our participants safe and supported in their homes.
Right. So we're going to go through each department, and somewhere along that somewhere along the tour, we'll see a chart.
That's
We'll
correct.
show all the participants.
Yes.
And that's great. And
Yes.
You can see exactly. The nice part about it is it's all geared towards geriatric.
Mm-hmm.
And we'll talk about it later, but there's a geriatrics. I guess we'll talk about it now. Geriatric is like pediatric. Pediatric is for children,
Mm-hmm.
and geriatric is for elders.
Mm-hmm.
And that geriatric care has only been around for 10, 15 years. I remember there was a time where I tried to find a geriatrician for a client, and it was like 4 or 5 in the state.
Right. So all the providers, all the team and support services that we offer here at PACE are designed for older adults. This program is available for people that are 55 years of age and older. So all of our team is well versed in elder medicine. The diseases that are associated with that, with aging, the medications, and the best therapeutic programs that they can put in place to support our participants.
Perfect. Linda is the activities coordinator here, and behind us is a lot of noise because people are having a good time, and that's because of what she does. And so anyway, I've known you now for how many years?
7.
7? And this is great. And it's funny because when we were told we were going to interview Linda, I didn't put Linda here because I worked with Linda at another place. And when she came through the door, it was great.
Yep.
It was like reconnecting.
Yep.
And so anyway, I'm so thrilled because you are awesome. And, anyway, I'm sure you
I do what I love.
There you go. And I think we talked to Gretchen, and she said it's passion. And you obviously have a passion, like we all have a passion for something. And so show me what's going on. So this is the July calendar.
Yeah, it's a small one.
It's a small calendar.
Yeah, so we want to keep everybody engaged. People do what they want to do. This is their program. So we go by what, they want to do activity-wise.
So what's today?
So today is the 20th. So they have bingo, which is a huge hit. They have exercise, walking group.
So on the
word
bingo,
games.
do they win a prize?
Yeah,
What do they get?
I'm very fortunate. I have a lot of friends that donate jewelry and knickknacks and things.
Nice.
So it's all donated things.
Okay.
Then we have card games.
So let's go back to donate.
Yeah.
Rewind.
Yeah.
So if anybody wants to donate some things to your project, to your program,
Oh,
they can.
we
What do they do?
welcome
They
everything.
drop them off
At the desk,
the front desk
and
with
just
Michelle?
say it's for activities. Yeah.
For Linda
Jewelry,
activities?
knickknacks, all
And
kinds of different
When
things.
they receive those things, do you go through and I know I have 3 grandchildren, and my wife is constantly washing
Oh yeah.
the toys.
Yep.
And even though They don't need to be.
Right.
They get washed. So when you get donations in like trinkets,
Yeah, we clean them and,
Clean
you
'em.
know, make sure they're age appropriate. Some
Yep.
people bring in stuff that's for little kids we can't use, but for the most part,
Yeah.
you know, it's age appropriate.
that's great.
And, you know, it's good because I can use the money for other things that I would buy for bingo prizes, so
Right.
they can have a better program.
Right. So what do you buy if they're donating? What do you buy?
I buy all kinds of supplies.
Such as
We do watermelon social. We'll do I do flowers. They plant flowers out in the yard.
So you go to Market Basket and buy,
Oh.
you go to the grocery store
Yeah.
and buy a watermelon?
Yeah.
Excellent.
Yep.
And that comes out of your budget.
Socials and whatever. Yeah. So
Awesome.
you know, and we have entertainers twice a week. So
Like what kind of entertainment do
we
you
have
have?
singers. There's,
I see.
You know, and then we
Chris-
also have
Chris Waters.
yeah, we have a
Rick Walsh.
prayer group that also comes in. I mean, it's pretty much
Different denominations.
for what they want to do. You know, it's all about them.
Great.
So we always ask, is there something you want to do? Or,
So we missed bingo.
yep.
So dominoes are two. We talked to George, and he loves dominoes.
Oh, yeah,
I've never played
he's
dominoes
the
in my
best.
life other than knock them down.
Yeah, we call him the mayor here. He's very,
Yeah.
very active and very positive. It's a good thing, you know.
So tomorrow you've got a walking group.
and then
you've
we
got
have a
word
guy that
games.
plays the guitar, and they have like a sing along. But
That's great.
there's something pretty much for everybody.
So what about when they're tired? so-
We have a quiet room where they can go. There's a recliner chair.
Because
They can
sometimes this
rest.
is a lot for people,
Of
right?
course it is.
Yeah.
Some of them are here all day, and so
Yeah.
they need a place to rest. So,
So
there's a
there's
couple of recliners they can go and lay down,
Okay.
and take a rest, and
Awesome.
get back up, and
They could chill out
yeah,
and come back to the fun and frolics.
right.
That's great. No
Yeah.
stress, no pressure.
No, we also have a memory unit
Yep.
for ones with dementia, Alzheimer's, and
Yeah. Cognitive care.
that's very busy. You know, busy room.
Yeah.
They keep busy, and we try to keep as least distractions as possible.
Well, I got to tell you, I'm thrilled to run into you again,
Yeah.
and
Me
I
too.
love what you're doing here.
Yeah, it's a good program, and
yeah.
it's great because everything's right here. The doctors are here, and
Yeah.
you know, social workers are here. So it's a great program for everybody to benefit
Yeah.
from.
And George likes the food.
Oh God, yeah.
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 And I see the menus right here.
Yeah.
So there's Caesar salad, there's teriyaki salmon with
Yeah.
wild rice,
Yeah.
corn with peppers, vanilla
Yeah.
ice cream cup,
Yeah.
and then they get cheese and crackers in the afternoon for
Yeah.
snack.
Yeah. So I'm bad. I don't
That's
have
great.
my
You
name
know,
badge
I know we've talked about this before, but one of the top 3 things in a person's life as they get to this age group is socialization.
Mm-hmm.
And you say you have a passion for this.
Oh yeah.
And that's one of the top 3 concerns. So thanks for.
So many people are home alone and they have nobody, and you know,
They're isolated.
And families are different. Like, you know, if you're not the same age,
Right.
you don't have a lot in common with the person. So at least here they have people more their age, and
Yeah.
you know,
and,
they're able to socialize. And
Yeah, and there are times where they come in, and let's face it, life hits them in the wrong place. So a buddy of theirs passes away, or a friend, and they come here, and they might be sad, and you detect that,
right,
and you send them to someone that they can talk to,
Yep.
or just be their friend.
right,
for the day.
and that's it. You got to earn their trust and
Yeah.
be there for
Yeah.
them. You know,
Yeah.
and it's huge. It's a big
It
part
is.
of
So
their
it's
life.
more than just playing bingo
No, yeah,
and dropping dominoes.
right. No, but they
It's
enjoy
reading.
it, and it's like a big family here too. When everybody leaves, they're always hugging somebody, or you know, or if somebody hasn't been in for an illness,
Yeah.
they're always concerned. Where are they?
Yeah.
How they doing? So it is. It's like one big family. Yeah.
Right. And I remember that with Linda.
Yep.
In Mattapan,
Yeah.
and I'd get phone calls, and I'd call, and everybody knew who I was, and the
Right.
connection,
Yep.
and they were always willing to ask and get. It was just a great feeling, and
Yeah.
and care and compassion
And that's what it is. You
is
know?
what it boils down.
I treat anybody here, if it was my grandparent, my mother, my
Yeah.
father, my aunt, my uncle, whoever. You know, you treat people the way you want to be treated, and that's
Yeah.
what it's all about.
Yeah, great. Well, thank you very much.
You're welcome.
Can I get a
Sure.
bring it in? Thanks,
Yeah, it was.
George. My name is Mark Cardoza.
Nice to meet
Hi.
you.
I'm with Well Informed by Think Smarts, and what we're doing is a documentary on the PACE program, Harbor Health PACE program.
Okay.
And you are a participant in the
Yes.
program.
Yes.
So,
Yes.
well, tell me, what's your favorite thing about the program that we have here?
First, I'll say PACE is the place.
PACE is the place.
Yes. I mean,
You
it's
coined that.
been going on 2017.
Okay.
I've been a member, and it's been a good place for me to come to relax, meet different people. We're all the same age, most of us,
Yeah.
and we know how to introduce each other, mingle, and we have good enjoyment. I appreciate the people that are very appreciative, polite.
How's the food?
Food is good.
Yeah.
Food is good.
What'd you have for lunch today?
Today we had balsamic salmon with rice over brown rice,
Nice.
and a salad with Italian dressing,
Nice.
and it was good. I mean, when I have my meal here, I have cereal for supper.
You have what for supper? Cereal for supper?
Because
Yeah.
it's good. I got to be light.
Isn't that typical?
Got to be light at this stage of the game. You got to
Yeah.
try to keep your level.
Yeah, but you get a nice meal here.
Oh,
You
very
get a
good.
snack or two.
Yes, we have
Yeah.
a snack.
Do you have
that-
breakfast occasionally?
Yes, we have cereal.
You had cereal this morning?
Yes.
That's great. That's great. So did you play bingo? What'd you do here?
Well, when you came in, we were playing dominoes,
Okay.
and the ladies like to play dominoes, and we get together, and we got some nice ladies that can know dominoes.
They know their
They're
dominoes?
very strict, very, very tough.
Honestly, I've never played dominoes as a game. I always stack them up and push them over and watch them
Yeah.
tumble.
Well, it's similar to checkers and chess.
Yeah.
You gotta the strategy,
Okay.
and you'd be surprised at the ladies that are very.
Maybe someday I'll come back and we can play.
Okay, we'll learn you. We'll
Yeah.
learn you.
So you get picked up in the morning?
Yes. The
So the
transportation is very good. I get picked up between 8:30 and 9.
9 o'clock, 8:30 and 9, yeah.
Between 8:30 and 9.
And then they come, you bring
They
you
get to
here, you
bring
have
us
your
here.
thing.
And we come in, and then we have our breakfast.
Yeah.
And
Then you go home at what time?
well, between 2:30 and 3,
Great. And when you get home, who's there for you?
my daughter.
Your daughter.
Yeah, just my daughter. Now my wife passed away 5
Oh, okay. I'm
years
sorry to
ago.
hear that.
And it's her and I in the house, and the cat.
And the cat. Of course. So what happens on weekends?
On weekends, well, I go walking because the days off, I do my walk.
Yeah. So you come here Monday through Friday?
No, I come here Tuesday, Thursday, and Friday.
Tuesday, Thursday.
Yeah,
Friday.
before the pandemic, I had Monday, Wednesday, and Friday.
So you
Thursday
can
and
change
Friday.
up your days.
Well, no, that's the days they schedule me.
Okay.
Gives
Cool.
me on those days, and it's good.
Yeah.
And those days that I home, my daughter's home.
Yeah.
And the other 2 days she goes to work.
Excellent.
Yeah.
So what would you like to tell us about PACE other than you've been here for a while?
Well, I mean, I come in and I
PACE
meet,
is the
I
place
meet-
to be.
Yes, and the aides are very, very, very polite, and they always very helpful. And my therapist, Erin, she's good.
Nice.
She's good. She gives us good exercises and try to keep us trim and fit.
Nice. You have to.
But the doctors and the nurse practitioners, they're good. But, I
Did
mean,
you give them an A+?
oh yes, because
There you go.
my health is good. They make sure that I'm physically fit.
Well, thank you very much.
Thank you.
I appreciate your time.
I appreciate yours. Yeah,
Right.
you're very good. Very nice.
Right.
Very nice.
We have the pleasure of meeting the Executive Director of Harbor Health, Gretchen Reynard. Gretchen, welcome.
Hi, thank you.
Oh, this is wonderful. I'm so happy to tour the facility. As we mentioned, that I've been a little part of the PACE team on the outside, and it's always great. I love the program that you guys represent, you work with. How long have you been with Harbor Health PACE?
I've been with Harbor Health just over 4 years.
Awesome.
Yeah.
So let me ask you a question. Let's do a deep dive.
Sure.
So when you were looking to come to work for Harbor Health, you kind of researched, and what did you see, and why did you pursue Harbor Health PACE? And I'm going to ask you a compound question. Why did you do that? And also, what inspires you to do what you do?
Yeah. So I'm a nurse practitioner by training. And so I think being able to care for and provide help to anybody is really at my core. And being able to do that work for an underserved population is even more gratifying.
Passion.
Yes, passion.
That's awesome.
Yeah.
And that's when, people tell me I'm passionate about what I do, and I don't see it,
Yeah.
but they see it.
Yeah.
And that's great. So where do you see PACE going in the local community, the local towns that we service now?
Yeah, so we're really at this point, especially around here in Brockton, we are looking to expand our services to a more diverse community. We know there's a lot of eligible PACE participants out there that could really use our services.
Yeah, and they're just unaware.
Yeah,
And
exactly.
that's where well-informed comes in.
Yeah,
right?
yeah.
That's great. That's great. So where do you see the growth as far as geographic growth? So let's back up a second. PACE is a program that works in a geographical area of a dense population. So you won't find PACE in the backwoods of Maine or mountainous areas. It's looking for an area that has a density. So with that said, where do you see PACE going, the Harbor Health PACE going?
Yeah. So we recently expanded our services in our territory to Attleboro, North Attleboro, Plymouth, Kingston, and then all of the South Shore towns. So we're really looking to grow our presence there. Again, we know there's a significant number of people there that could benefit and are eligible. So we're hoping to grow our presence there.
It's funny you say that because I was with someone last week or so, and he actually works in an assisted living community, and we started talking about PACE. So that area is new to you guys.
It is. It is.
Okay,
Yep.
great.
Yep. Yeah.
That's excellent. So what would you like the viewers to know about PACE?
Yeah.
What do you want to tell them?
I think I would just say that anybody that caring for an elder, or maybe they're an elder themselves, and they're looking for support from a really large interdisciplinary team, they're looking for medical care from a geriatrician, and could possibly use the services of our Adult Day Health Center here. We have a location in Brockton and one in Mattapan. Then PACE is really the place for you. We offer it all.
That's great.
Yeah.
That's great. Well, thank you very much.
Thank you.
It's
It was a
great, and I
pleasure.
appreciate you letting us in and showing us your center.
We're happy to. Thank you.
Thank you.
Joseph is the lead RN for the center. And Joseph, I'm going to leave it to you. Show us what you've got.
Okay, so we have the clinic at the center, and that's where our participants come. So that way they can be seen if they have any issues that's going with them medically. So we do have a medical assistant that's sitting there. So whenever the patient comes in, we call them participants. So they get checked in here, and then they get walked into the clinic area. So that way they can be seen by a provider.
And you're available to them every day.
Yes, every day. Yes,
Great.
and I do have Sheila, who's an LPN that's working with me at the center, and so that way, when I'm in the clinic, she's in the center area where she can see the other participants.
So if I'm a participant and I have a bad night,
Yes.
I can come in and tell you my problem.
Absolutely. So typically they'll be calling our main number, and then we'll arrange with the transportation so that way they can be brought here instead of going to the hospital. They'll come here and get seen in the clinic by the provider.
So that's if I'm a part of the home care section.
So that's if you are a participant enrolled at PACE.
Doesn't matter.
Does not
whether
matter.
I'm getting services at home or getting services here.
That's correct.
I can come here any day of the week, 5 days a week, Monday through
5 days a
Friday,
week, yes.
and you'll take care of my ailment.
That is correct, yes.
Awesome. So show me the rest of the place.
So this is the office for the providers that are here. So Dr. Calendar is actually here today. And this is the room that we have. So we have 4 rooms down there. As they come in, they get the vital signs checking, starting with weight. And then they get brought into a room where they will be assess with the vital signs, and then wait for the provider to come in to see them.
The provider being the doctor?
That's right, yes.
Okay.
So we have 3 doctors that are here, actually 2 doctors and 2 nurse practitioners that comes in to see the
On a
participants.
regular daily basis?
That is correct, yes.
Wow. So how many patients do you see in a day? How many participants
Participants, that's
do you
right.
see in a day?
Yeah, it varies. Like last Tuesday, we had 9 that was scheduled.
9.
That's a very heavy day.
That's a heavy day.
Yes, it is.
Heavy lifting.
Yes, it is.
9.
Yeah.
And what's the lightest day you see?
That is, there will be 3 to 4.
Wow.
Not counting what's called episodic visits. So we have participants that are scheduled to be seen.
Yeah.
But at the same time, if somebody is here, something's going on with them medically, they get seen also.
Wow.
Or if somebody's at home, there is some issues, instead of them going to the hospital, they'll call and we'll get transportation, or their family member can bring them in. So even though it's scheduled, but it's not set, because if somebody's sick, they need to be seen, we bring them in also.
So with the scheduled and the non-scheduled, you might see 15 people in a day?
It's possible.
Right. So I was being sarcastic when I said that's heavy lifting.
Yes, absolutely. Absolutely.
That's a really easy day, I think, in the world of medical doctors and nurses seeing patients.
Exactly. So like, for example, for today, not only we had patients that are scheduled, participants that are scheduled to be seen, but we had the podiatrist that was here also. So that's probably another 12 to 15 participants that get seen. Although the specialty, so it's podiatry, audiology, and optometry that we have periodically. They rotate every 2 or 3 months or so.
Any other specialists?
So that will be just those three that I mentioned.
So question for you. I know it's an all-inclusive program, meaning all the doctors, all the medical is done here. But what if what if I have a cardiologist? What if I have a heart condition?
So if you do have an issue with your heart and you need to be to the cardiologist, the provider here will write up a referral, and our Brockton schedulers will make sure that the appointment is scheduled, and our transportation will bring that participant to that appointment.
Okay, so let me just clarify. I have a heart condition. Mm-hmm. I'm a participant.
Right.
I have a cardiologist that's down the street. Mm-hmm. That cardiologist continues to care for me.
Right.
And I see them, and the PACE program pays the copay to him, and I don't have to worry about it.
That is correct. So providing that it's approved by the provider first, because we have to have what's called a memorandum of understanding.
Sure.
So that way the provider would have to approve that technicality to be seen by the cardiologist.
Do you ever run into problems with that?
Definitely not. No.
Not yet.
No.
Okay, good. It's good to know.
Yeah, absolutely.
So what other kidney issues you'd send out to their referral to their doctor that's handling their kidney? How about diabetes?
Oh yeah, so we have a variety of participants here that have diabetes, dialysis. So we have a few participants that do go to kidney centers. But while the providers here handling their care, so we coordinate with the kidney center to make sure that they getting the right medical assistance.
So it's sort of an extra layer.
It is.
So
Absolutely.
not only do I have you caring for me,
right.
I have my cardiologist or my other doctor, endocrinologist,
right.
caring for me that I've had for years.
Right.
And it all funnels back to here.
That is correct.
Where
yes.
the doctor at PACE oversees all that. And that doctor only has how many patients in their circle?
So they might have 50 to 60, so it depends. So they're all different because we go by region.
It's pretty focused care.
It is, absolutely.
Oh, that's great.
Yeah. So.
Anything you'd like to tell us about PACE?
PACE it's a great program, and I've been here 5 years, and I'm not really used to it. But then when I came here, it was mind-boggling the care that's being provided, so that way the participant can stay in the community, and that's the goal of PACE, to keep in the community as much as possible, or as long as possible.
Wonderful.
It's a great program.
Well, thank you very much.
Absolutely. Thank you so much.
Appreciate your time.
Appreciate it. Thank you.
Take care.
All right.
Kerry, I think this is one of the biggest and most impressive part of the care at PACE. So here are each of the departments that a participant can participate in or be cared for by these. So talk to us
Sure.
about it.
Well, you've seen so much of the program today and all the different aspects that that are involved with PACE, but really this is the heart and soul of the PACE model, and this is our geriatric team. So these are all the different disciplines that come together each and every day to provide care to our participants in an array of their needs. So as you can see, we have our nursing office, our registered nurses, recreation therapy, we have dietitians, we have occupational therapy, we have a center manager, a coordinator of home care, we have personal care attendants, drivers, primary care provider, social services, as well as physical therapy. And these folks all work together here right at the PACE Center exclusively, as well as in the homes.
Right. And in conversation with Joseph, the lead RN, one of the questions I had is what happens if a person has something, a need like a cardiologist, a specialized doctor.
Right.
So tell us about
there's
that.
lots that we do right here at PACE, but certainly there are other specialists that are involved with people's care, and we can coordinate that. So we understand that people have had long-standing relationships with specialists. Oftentimes upon their enrollment into PACE, they're able to maintain those relationships.
That's great.
But the coordination of care is still all done right through PACE.
So you have a point person
Yes.
here. So PACE is the point person,
Right.
coordinating what's going on inside your organization. And if you need to pull in specialists, then you bring them in.
Correct.
Awesome.
Yep.
Is there anything else you'd like to tell us about this?
So this model is what is unique about this model is that you have a very well-coordinated team that's communicating together each and every day, dealing with a very small panel of patients, but understanding that our participants have very high complex needs. And as we mentioned, these are individuals that might otherwise live in a nursing home, and how nice that it is that our participants are able to age with dignity and independence in their community setting of choice. And it's all because of this team that is so creatively and carefully working to meet their individual needs.
That's ideal.
Interesting enough, during our tour, an ice cream truck showed up. And I guess that was on the agenda for that Linda showed us. So everyone at PACE today got a chance to have an ice cream, which I think is an awesome treat. And I think that all works out well for people. Thank you very much. Thank you, Kerry, for a great tour, all the information, and of course the hospitality.
Oh, it was
It's greatly appreciated.
so happy to have you.
This was a treat I wasn't expecting.
Thank you.
Anyway, for our viewers to get in touch, get more information on Harbor Health PACE program, they're welcome to reach out to PACE. The information's on this documentary. You're also welcome to reach out to the Retirement Education Center of North America. Well Informed is part of the Education Center, and Positioning for Retirement is one of the tools we use to help educate people. Also, thank you to ECAT for doing this documentary for us. And as people may or may not know, ECAT is a nonprofit and donations are important to them. So for a $10 donation, we will email a PDF copy to you of Positioning for Retirement. For a $20 donation, we will send a physical signed copy to your home. And on top of that, if you don't want to donate, you're welcome to find Positioning for Retirement on the local author's shelf at the Ames Free Library. So until the next time we see each other again, I hope you have a safe and well-informed day.